Real news for Americans 50 plus. This is Emeritus News Channel.
Thank you again for your interest in H1N1 influenza. Vaccine supplies continue to increase. Today we're releasing information on vaccine safety that's reassuring, and during this window of opportunity, it's a great time to get vaccinated. As of today, there are 73 million doses of H1N1 vaccine available. That's twice the number that were available a month ago. It's 10 million more than last week, and we expect at least another 10 million doses in the coming week. Priority groups are still the priority for vaccination, and we need to reach particularly groups that have been historically undervaccinated. For example, school kids. Usually only about 1 out of 5 school kids gets vaccinated. We have areas of the country which have been very creative in reaching out to school children and in doing school-based vaccination programs. In Arkansas, Maine, Rhode Island, to name 3 states, they're telling us that at least half of the kids in many school districts, and even higher in some areas, are being vaccinated against influenza. That's a tremendous accomplishment. It protects those kids, it protects their families, and most likely it protects their communities. And that's the kind of program that's building not only a response to this particular vaccine, with this particular vaccine to this season, but building an infrastructure for the future so that we can vaccinate more children at schools and their pediatricians in the future and dampen the future waves of seasonal influenza in the years to come. In addition, we have an increasing number of obstetricians who are vaccinating their patients, or at least knowing where their patients can be vaccinated. That's important, not just this year, but every flu season, because pregnant women are much more susceptible not just to H1N1, but also to seasonal flu, and vaccination can protect them. Vaccination not only prevents severe illness, it also protects us from disruption in society. And people who are out of school, out of work, infecting others, sick in bed for a few days, all of that has a big impact each flu season. And whatever we can do to reduce that, we'll benefit from in this year and future years. We don't know how likely a future wave of H1N1 influenza is this year, but we do know that the more people who are vaccinated, the less likely we'll have more spread in the coming months. Now, I would like also to talk a little bit about vaccine safety, because today we're having release of information in the MMWR. We're very committed to transparency. We provide the information on the web so people can see what reports are actually being submitted without anyone's individual information. And the information is very reassuring. Although still preliminary, although it's still early, we know that the rate of, for example, Guillain-Barré syndrome, the rare neurological condition that was more common after the 1976 swine flu vaccination campaign, we have not seen an increase that would be significant. And in fact, the likelihood that we'll have a 1976-like problem with this year's H1N1 influenza vaccine is vanishingly remote. So this is reassuring. We do expect to see lots of reports. We particularly expect to see reports when there's a new vaccine in the first year of each new vaccine, because people are concerned, and we investigate the serious reports and we provide that information openly to the public, and you can see the details of that in our MMWR released today. We will continue to intensively monitor for any adverse events and investigate any. We can't be certain of safety of many things, but we're very confident at this point that the kind of problem we saw in 1976 is really, really unlikely to occur this year with Guillain-Barré syndrome. Whether there will be other problems with this or other vaccines or treatments, only time will tell, and we'll continue to monitor that very intensively. As there is more vaccine available and more confidence in the vaccine safety, it is a great time to get vaccinated. Next week there will be public service announcements, particularly for the priority groups, on the importance of getting vaccinated. And again, it's a window of opportunity as the disease has continued to ebb and as the vaccine supply has increased to get vaccinated. Disease continues to decline. There are now 25 states with widespread activity, so there's still a lot of excess influenza, more than we would expect this season around, but it is continuing to decline. There's more flu than usual, and as it has since the beginning, it affects young people more. Sadly, this week we documented an additional 17 cases of children who died from influenza. That brings the total of laboratory confirmed deaths among children to 210. We're seeing some other viruses, not influenza, but other viruses that cause colds and flu-like symptoms and fever. We're seeing more of those spreading. That's what we expect in flu season. We're still seeing very little seasonal flu, non-H1N1, and that's not unexpected for this time of the year. This is around the time of the year we might begin to see that pick up, December, January, February. So we'll see what the future brings. And as we've said consistently, not possible to accurately predict what's going to happen with influenza. We don't know how much more H1N1 there will be, whether there are additional waves, and if so, what they will look like. Because there's been such a difference in influenza in different parts of the country, in the spring there was a 20 or even 100-fold difference between different communities with how much influenza there was. We don't know what the rest of this flu season, which lasts until May, will be like. And it's quite possible that some areas will have problems and others not. We just don't know, and we'll continue to very intensively monitor. One of the things that this flu season has allowed us to do is greatly increase and intensify our ability to monitor for influenza, monitor the trends in the virus, in the patterns of disease, and in the adverse events, which we've reported today. That adverse event reporting also outlines additional systems we have in place to help us try to understand if there is a very rare problem with the vaccine. Of course, the challenge of finding a very rare problem is that it's very rare. So whether or not that will be found, we can't say with certainty until later, but the information that we're releasing today is reassuring. I'd also like to mention schools closure. This was something that was a big deal in the spring where lots of schools closed. If we look back at the month of November with lots of disease in many places, very few schools closed, consistent with the revised guidelines that we issued over the summer. One of the challenges with influenza is to ensure that at the same time we're doing everything possible to reduce the impact and to protect people, we also respond effectively so that we keep sick people out of school and keep our economic activity going, keep kids learning, keep people going to work, whether it's telecommuting or being at work because they got a vaccine and didn't get sick. So going forward, I think we're still in a period where we're changing gears from a time when there was not enough vaccine to a time where vaccine is increasingly available. Vaccine is important. We don't know what the future will bring. It's a great time to get vaccinated. We have even more confidence in the safety of the vaccine and even more availability of vaccine so that people can get vaccinated. We can't predict what the flu will be like. We also can't predict what demand for a vaccine will be like. We know that when there's more disease around, people want to get vaccinated more. We know that when there's less vaccine, people want to get vaccinated more. But this is really a great window of opportunity. There's more vaccine available. The focus is the priority groups, people who will benefit the most from the vaccine, but an increasing number of communities and states are providing vaccine to larger groups of people, and that's completely consistent with the recommendations of the Advisory Committee for Immunization Practices. Vaccination is the single best thing that you can do to protect yourself and your family against the flu.
This is Emeritus News Channel.